Hi everyone, so in this video we will be going over the Pathophysiology 240 midterm exam. This one is very similar to the one that's already posted. The only difference is that this particular review has a blueprint, so a breakdown of each, I guess, the questions that come out of each particular module. Okay, so let's go ahead and get started. Midterm exam will consist of a total of 75 questions. 73 of these questions will be multiple choice and 2 questions will be true or false. So module 1, we have the introduction to pathophysiology. In this particular module, we have 19 questions that are coming out of module 1. So this includes cellular adaptation, infectious signs and inflammation, tetanus, wounds, fistulas, GERD, and bacteria. If you need to pause and take a picture of this, you are more than welcome to. Module 2, so it will be in immune system, blood, circulatory disorders. There are 30 questions coming out of this module. This includes genetic disorders, autoimmune disorders, hypersensitivities, cancers, venous insufficiency, coagulation and clotting, anemia, blood loss, varicosity or varicose veins, DVT, post-viral infections, immune response, immunoglobulins, and immune deficiency. Module 3 will consist of cardiovascular and respiratory disorders. There will be 26 questions coming out of Module 3. This includes cardiac events, heart failure, heart disease, infectious endocarditis, pneumonia, pneumothorax, pleural effusion, acute bronchitis, dysrhythmia, exarctorant, asthma, emphysema, MI, cardiomyopathy, and yeah. So if you want to take a picture of this particular part, I would suggest pausing this and kind of getting like writing this down of, okay, these are, you can see here, there's 1 question coming this, 2 questions coming MI. So use this and then go back to your PowerPoint and just highlight that. Yeah. All right, so our study guide. So inflammation, so we know that the classic signs of inflammation are going to be swelling, redness, and heat. And I've already mentioned this before, but just as a reminder, all of your questions for pathophysiology, you're going to start thinking kind of as situation-based. So you as a nurse, so you have a patient comes in, they want to know what are the classic signs of, or they're experiencing classic signs of inflammation. What would those be? So we know that that's going to be swelling, that redness that you're going to see, and then also whenever you're touching, they're going to have that heat. Okay. Autoimmune disorders. So systemic lupus erythematosus, so SLE, you're going to see that butterfly rash across their cheeks. There's stiff, painful joints, high blood pressure, and as you can see in this picture, that rash. Infections and antibiotics. So bacterial meningitis, antibiotics are the appropriate first line of therapy. So you have a patient comes in, you know that they are positive for bacterial meningitis. So what would be, you have a bacteria. So the thing that is, I guess, first line of therapy, the appropriate part would be antibiotics for bacteria, right? Okay. Muscle atrophy. So the prevention of this is making sure you're getting your patient up, okay? Making sure that they're using the range of motion exercises, that they're participating with physical activity, and they're not being on bed rest, right? So GERD, gastroesophageal reflux disease. So metaplasia, so this is seen during chronic stomach acid irritation. So the way we detect this is through an endoscopy and then getting that biopsy, okay? So we have here a normal esophagus and that injury or that inflammation, okay? cellular changes. So dysplasia, so this is abnormal cell growth that has potentially formed or for malignancy. So an example of this would be chronic ulcerative colitis. Squamous metaplasia, this occurs when as a cellular adaptation. So this is often due to chronic exposure to toxins. An example of this could be like cigarette smoking. Genetic disorders, Tay-Sachs disease. So this is characterized by progressive neurological decline in infants. So this potentially could lead into blindness, paralysis, and respiratory failure. So thinking again as what are signs and symptoms, and also what is the projection? What is something that we can see with this disease? What is something that it can cause for our patient? Down syndrome. So we know, I'm pretty sure that all of you, if you took Bio 189, AMP, you've probably already seen this question in different formats. So what is the diagnostic test for Down syndrome? We know that this test is called karyotyping, so it confirms that diagnosis. Cardiac conditions, so MI, myocardial infarctions. The signs include severe chest pain, diaphoresis, pain that's unrelieved by nitroglycerin, so by nitro. The healthcare team will anticipate MI symptoms if they're present, right? VF, ventricular fibrillation. So this is a life-threatening cardiac dysrhythmia. So this is marked by a rapid, uncoordinated quivering of the ventricles, okay? Angina, so this is chest pain that is relieved by rest or nitro, okay? So what is not relieved by nitroglycerin, that's going to be an MI. And angina, that is going to be relieved by nitro or rest. Heart failure versus MI. So heart failure, it's chronic and with an ability to pump blood infectionally. MI, that's acute. So if we think back, I know I've spoke to some of you guys about this. So acute, it's only cute for a little bit or a short time. Chronic, it's going to be chronological. You're going to take more time, or it's going to be a longer process for that. So heart failure, that's chronic. Acute, it's only cute for a short time. So your MI is going to be only for that short time. Left ventricle heart failure. So some of the symptoms that for your left ventricle heart failure would include crackles in the lungs. So let's just say a patient comes in and you are assessing them, and then you start hearing those crackles in the lung. That would be a sign and symptom that you will see for that left ventricle heart failure. Right ventricle heart failure. So these are classical signs of this, signs and symptoms, are the jugular venous distension. So backward effect, including those astrocytes. For pulmonal, so this is a right side heart failure due to pulmonary issues. So we have hypoxia, edema, the swelling of your feet, shortness of breath, COPD. So respiratory disorder, so acute bronchitis. Some of the symptoms that include would be persistent cough, a yellow sputum production, and this would be treated with expectorants. So again, signs and symptoms, acute bronchitis. For all of these, my recommendation for you would be putting all of these parts, these diseases, I guess, or these, I'm forgetting the word, but putting these all into categories and then putting the signs and symptoms of each one of these disorders. That's the word, disorders. So acute bronchitis, signs and symptoms for that. MI, signs and symptoms for that, okay? Pneumonia. So pneumonia, this is inflammation of the lungs. So commonly caused by bacteria, viruses, or fungi. Okay. So Streptococcus pneumoniae, this is the most common cause of community-acquired pneumonia. I know you guys learned this in microbiology, so make sure you remember this. Emphysema. So emphysema, this is characterized by the loss of that elastic recoil, okay, in the lungs and the tissue. Pleural effusion. So this is caused by an increase of hydrostatic pressure in the pleural space, leading to that fluid accumulation, okay? So there's so much space that it starts accumulating that water, right? Or that fluid. Absence of breath sound. So this may indicate pleural effusion or pneumothorax. Wound healing. Okay, so my recommendation for you is really to know all the different parts. There is a chart on your PowerPoint and it explains all the different types of, I guess, primary, secondary, third intentions of wound healing. Make sure you know all of those. Secondary intention, this occurs when all the wound edges are not approximated. So this leads to that scar formation. Okay, so the secondary intentions of wound is left open, closure formation of granulation tissue, and that scarring, right? Wound dehiscence, so this is separation of wound layers, typically due to compromised closure, okay? Again, stages of wound healing, same thing. I would make sure that it's in your PowerPoint so that you are writing all of this down and putting down, okay, part or step 1, step 2, step 3, step 4, right? So the stages of wound healing go from hemostasis, inflammation, proliferation, wound contraction, and then remodeling, okay? Hypersensitivities and allergies. So IgE, I know you guys reviewed all of this over AMP2. So IgE is the immunoglobulin response that is pretty much responsible for all that hypersensitivity reactions. So these are pretty much found in all of the allergic responses. So the allergen or the IgE factor, this is the primary part for allergies. Type 2 hypersensitivity. So this involves cytotoxic reactions. So these are an example of this would be like blood cell destruction. Allergic reactions, again, that plays a part in mast cells. 1 second. So allergic reactions, so mast cells play an essential role in pathophysiology of the allergic reactions. So this is an example of this is such as hay fever or seasonal allergies. Hematological conditions, so anemia. So this is defined by decreased hemoglobin concentration. I know you guys learned this on AMP2, so all of this is pretty much kind of review. So these concerns include hypotension. So remember, hypo is low, that hypotension due to low blood volume. So you're going to have a low blood pressure due to low blood volume. Iron deficiency anemia. So this is commonly presented with symptoms that such as hair loss, craving for eyes. Those are going to be typical signs for your iron deficiency anemia. Sickle cell anemia. So this is when both parents are carriers of that gene. So they both must be carriers of that gene so the child can inherit that condition. Okay. Prolonged bleeding. So this may occur due to the absence of clotting factor. So remember, if you remember back in AMP2, you were talking about the fibrogen that comes in, makes that clotting factor. So with this there is no clotting factor, so there's going to be prolonged bleeding. Okay. Viscosity, so this is defined to the abnormal dilation of the superficial veins. So normal vein, varicose vein. DVT or deep vein thrombosis, some of the risk factors may include immobility and reduced mobility. So the varicose triad. Oncology, so chronic leukemia. So this is characterized by B cells that have failed to mature. Hodgkin's lymphoma, so it's presence of Reed-Steinberg cells. Know that males are at a higher risk than females, and especially if they have a history of the Epstein-Barr virus, okay? So if you have a patient, they come in, it's a male, and they're saying, I have a history of Epstein-Barr virus, we know that they have they have Hodgkin's lymphoma, or potentially that they could, right? That's a risk factor for them. Neoplasia, this can result if cells fail to go under apoptosis. So this leads into that abnormal growth. Viral infection. So Epstein-Barr virus. So this is what this causes an infection like mono. So mononucleosis. Infections like mononucleosis. So these are often referred as mono. They spread through saliva and then they cause that Epstein-Barr virus. Myocardial infarction, so MI, so elevated levels of cardiac troponin are indicative of that heart muscle damage, okay? So remember, MI, they're cute. They're acute for a short time, but they can cause a lot of damage. Neurological disorders, so Huntington's disease. So this is characterized by chorea. So the involuntary movements. So this is followed by behavioral changes and cognitive decline. Inflammatory response. So chemotaxis. This refers to the movement of white blood cells to the site of injury during inflammation. So think of your little chemo taxis. Your taxis are moving your white blood cells into that site of inflammation or injury, okay? So your little taxis are moving over to make sure everything is okay. Phases of acute inflammation. So this includes changes in vascular permeability to allow that immune cell to access that site of injury. We have CABG, so coronary artery bypass graft surgery. Okay, that's a drawing influencer. Okay, thank you. So coronary artery bypass graft, so CABG. So this creates new routes for blood flow that can treat angina pectoris and myocardial infarction. This is just review karyotyping. So this confirms that chromosome disorders like Down syndrome. Cystic fibrosis, the treatment for this include that chest physiotherapy, corticosteroids, reduced inflammation, airway clearing techniques, so making sure they're doing the so that can go up and be released. Bronchodilators. And make sure you know the prognosis. Prognosis is expected outcomes of that particular disease. The etiology, so think of ethics and all the stuff. You're studying the causes of that particular disease. And then disease, it's defined as that deviation from that normal state that you have of health, okay? And then just miscellaneous things to know. Muscle weakness and puncture wounds, so symptoms such as muscle spasm and difficulty relaxing those muscles indicate intentness. So this could be Clostridium tetani, Clostridium botulinum, so sorry, produces a toxin that may prevent muscle contraction. So your muscles aren't contracting. So what happens? This can lead to paralysis. Having high cholesterol, this contributes into that buildup of the atherosclerotic plaque. So this leads in that cardiovascular disease eventually. High fever, so this leads an increase. I know you guys learned this in A&P too. This is a high production of pyrogens, okay? High fever, high pyrogens. Fistula, so fistula refers a connection between the two structures, so are used in hemodialysis. All right, and I think that is it. So if you have any questions, please don't hesitate to reach out. I know that there was a lot of content, so I tried to break this down and make this as easy and kind of quick little study guide for you guys. If you do have questions and you want something more of a breakdown that isn't too fast, let me know. I'm happy to walk this down, walk through this information with you. I also have I will be posting, actually, let me go ahead and to share my screen again. I have these review questions that they're a little bit more that higher level thinking and into, for instance, you have a 30-year-old runner, Kevin. He presents into the clinic, so he's going through it. So these are more like scenario based. I have one for each of the particular modules. So if you have a chance to take these quizzes, I highly recommend it. I also have the worksheet that you can download, or you can take the quiz however you like. Again, if you have any questions, please don't hesitate to reach out. If you would like to kind of walk through this a little bit more specifically, let me know. And again, best of luck. You got this. You're very close to finishing.